So I have patients that come in and especially if there's some first bout of low back pain and it's late in life, like over 45, most people have dealt with some tweaks and aches and, you play sports or whatever and you
Hmm.
stumble. And so you kind of have an idea of like what it is, but there are that subpopulation of patients that have never experienced like true musculoskeletal pain until they're 45, 50. So when they feel it,
Damn.
yeah, yeah, you're like, what a life.
Nice. Good for them.
They're like, when they feel it for the first time, they're scared because they're like, I've never been such an invalid. I was, day before I was completely fine. And today I can barely walk without support or leaning on something. And for them, when you ask like, how bad is your pain? This is legitimately the worst pain they've ever felt in their life. Like legitimately. And it's scary. Like what, and it's so difficult in like pain care because like, I don't know what your pain actually feels like. Like I know what my version of pain feels like. I know that it kind
Well,
of
it's so
has like
subjective.
yeah. And what you're calling buzzing or aching or sharp, I might be calling your sharp might be my pokey. Your pokey might be my, tingling. Like we don't know the words because nobody ever taught us what to describe those things. Like we're guessing, right?
Yeah.
So anyways, in those people that it is like their first bout and it is serious and they think, oh, I'm never going to get past this. I want to honor the fact that like, hey, in this moment right now, you probably think this is the absolute worst thing that's ever happened to you.
Yeah.
Now, I know that 6 weeks from now, you're going to forget, you're going to be like past this, you're going to be fine, you're going to be playing and hiking and playing pickleball or whatever. But right now, it's scary. And so I think that validation thing is so important because sometimes, as a provider, like one of the red flags in our office is if you tell me, oh, I have a high pain tolerance, that's
Hmm.
usually code for I don't, in fact, but I just want to, brag to my friends I do. And then I
Yeah.
need some woman that had like 4 kids at home with no, and you're
Right.
like, okay, you have a high pain tolerance. I'll quote during.
Yeah.
But I also don't want to be cold and resistant to those people to say like, oh yeah, this is a 10 out of 10. This is, the worst pain I've ever felt. It's like, I bet it is right now, and it sucks. And I'm sorry.
Yeah. I kudos you for pain care because that's a tough area for sure.
Yeah. I have friends that work in like chronic pain and I'm like, no, thank you. Like
No.
that is the Lord's work right there, boy.
Yeah. I have patients who have chronic pain and I'm like, okay, well, let's at least get your hot flashes under control.
Yeah. I'll take one.
Might make things a little better. Yeah. I'll
Yeah.
take a slice of the pie.
Yeah. So in those situations when I am dealing with somebody with a worst pain in life, or you're dealing with somebody that's, experienced their menopausal symptoms for the first time, how do you lay out like a reasonable understanding, caring future without overpromising? Because you may not be able to get them under control, right? Or they may get
Yeah.
worse, right? And that's the tough part of what we do. But what have you learned there?
Yeah, so I mean, I do prescribe a lot of hormone therapy, right? Following the North American Menopause Society guidelines and just sort of what we have available for hormone therapy options. And I always sort of like to manage expectations and say, we might have to try a couple different things. I always start at the lowest dose and work our way up and just sort of, I think when you lay it out to patients that like, this is a long game, this is not a short term. Like, yes, we might put you on progesterone and it might be immediate change. Cool. We might have to navigate in a year or 2 years when your hormones change more as you sort of head towards menopause. And I think when people understand that it's a long game, this doesn't really happen overnight and it doesn't get fixed overnight. We're also always just looking to improve symptoms, improve quality of life, improve symptoms, and also obviously outcomes with, bone loss and osteoporosis and things like that. But I think again that when they trust you and they like you, because that matters too. When you have that established foundation with them and that you do all the safety screening and you look at risk factors and you have approved hormone therapy. So yeah, this is, I think, our best option. We are expecting your hot flashes to improve. And I always say, I'm not saying they're going to go away, but I'm saying, in the next couple of weeks of this estrogen patch or whatever we're going to use, we are hoping that the severity, frequency, and intensity decreases. And they're like, okay. So we do the questions right now. Where are you at with these hot flashes? They're like, hey, 15 times a day and they last for 30 seconds and they're really bad. Like, hey, well, then in a month you come back and you're like, you know what? I get like one a day. I'm like, hallelujah. That is a substantial improvement, right? Again, they might not be gone, but we're always just looking for improvement, right? And then just that close monitoring, But when you lay it out from the beginning of these expectations and what our anticipated things are, and again, it's hormones, right? So everyone's a little bit different. Everyone's at a bit different stage. They don't really test them because serum values for hormones are also wacky or menopause. Then they're hooked. They're like, okay, yeah, I'm ready to deal with it. They're ready for any improvement, really.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by TrustDrivenCare. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust-Driven Care. If you're ready to streamline your practice, check out TrustDrivenCare.com and see what's possible. Trust-Driven Insights. Real conversations. Smarter care. Stronger business.